As a gastroenterologist, I get this question a lot of times from my patients about anal fissures. They're vexing problems, and I see a lot of patients with anal fissures. This is the anus, and this is the rectum. And these are hemorrhoids. These are internal and external hemorrhoids. And this is the anal canal. And this is the area where fissures happen. And what is a fissure? So let me show you something else. You can see a fissure is a split in the skin of the anal area. So imagine a paper cut. So if you have a paper cut on your hand, it might be less painful. But that's an anal area, so it's a paper cut in the anus. So that's where when you pass the stool, it kind of rubs on this area as you pass, and it passes across it and causes a lot of pain. So typical symptom with anal fissures is pain, and occasionally they can cause some bleeding too. So when you have bleeding, it will be usually a small amount. It's not a large amount. Small amount, I mean, it could just be on your toilet paper, or it could be less than a half spoonful, or it could be a few drops. And one of the telltale signs of the fissure is that severe pain that happens when you're passing stool. And fissures can happen in various directions. Imagine if this is your anus and you have a circular structure there. So depending on the angle at which it's located, we mark it as 12 o'clock, 6 o'clock, 3 o'clock, or 9 o'clock. So we for our ease, we mark where the fissures are when we examine someone. So how do you diagnose them? It's done in the office. Usually a patient comes in with severe pain when passing stool. Sometimes they have trouble sitting even, like it causes so much pain they can't sit. So then we examine them and we find out, and usually exam is pretty simple. It won't cause any pain and you don't have to do a detailed exam. Most of the time, as you pull the anal skin apart, like you separate it, and then you're able to look at the fissure, and then it would be also decided which location it's on. But in certain diseases like Crohn's disease, you can have anal fissures that don't heal. And those anal fissures can also develop in atypical locations. In normal locations, there are certain positions where you see fissures normally, but these happen like in odd positions, like in these angles or those angles. Or sometimes they're non-healing, or they can have multiple fissures. Multiple fissures is even more problematic. So then we start thinking about Crohn's, like correlate with the patient's history as to what else is going on, or correlate with the endoscopic findings or with the capsule endoscopy findings, etc. So now you diagnosed it in the office, then what do we do next? If it's an acute fissure, which happened like just for a few weeks or few days, usually the story is that the patient got constipated and they passed a hard turd of stool that kind of caused the anal area to stretch and cause a tear in that anal area. And usually that heals with time, but you just need to make the stool soft so that it doesn't cause any more problem when it passes through. So if you keep your stool hard, then it's going to rub against it and make the fissure worse. So that's the usual story. It's an acute fissure. But then it happens that some patients are, they don't take care with their constipation, and they can cause hard stool to pass several times across the fissure or across the anus. So it's like they pass a hard stool like once every 2 days, 3 days, or they don't pass stool for a few days, and then a hard turd of stool comes out, and then it causes this healing fissure to flare up again, because you're passing it, then you're healing, then you stretch it all over again, and then it flares up and causes that pain as well as the bleeding. So best thing with fissures, always keep the stool soft. And how do you do it? is just by taking things like fiber. There are things like benifiber, which is a soluble fiber, or metamycel, which is an insoluble fiber, or things like miralax or polyethylene glycol. These are two of our favorites, like fiber and then polyethylene glycol. They help to keep the stool soft. So when you have soft stool, your problem becomes less. It gives time for the fissure to heal. And as you saw in the picture, if it becomes chronic, then if, let's say you did all that, but it's not healing, then what next? Then we can inject Botox into the fissure. As you can see in this picture, now if the fissure is here, you inject Botox in here as well as here in two different directions. And what does Botox do? It's a muscle relaxant. So these muscles around open up and let a lot of blood circulation to happen. So that allows the fissure to heal, and that is what is needed for it to heal some rest. So in the acute setting, you could use a donut pillow where you could sit on it, and that will allow the area to not touch the seat, so that the pain is not as bad. And also you could do something called sitz baths. So sitz baths are where you fill up a bathtub like that deep with warm water, and you soak the bottom in it like 15 minutes in the morning, 15 minutes in the evening, and it relaxes all those muscles and helps the fissure heal. So those are two things that can help fissures, a few things. Then using some warm compresses might be useful. People can try, people sometimes try it. Lateral internal sphincterotomy, and where they cut this internal sphincter, and it kind of relaxes the muscles there and helps increase the blood circulation. But there's also a certain number of patients who can develop fecal incontinence, which means loss of stool without their knowledge, meaning leakage of stool that can happen too. But otherwise it's a pretty good surgery that can help long term with the issue. And one other thing not to miss is you could use ointments that can help with anal fissures. So the ointments usually are something called erective or nitroglycerin ointment. You just put like a dime sized portion on your finger, and then you just rub around the anal area to wherever how much ever it can go inside. And then you do it like 2 or 3 times in a day, and it helps relax the muscles again and increase the blood circulation. And then the other ointment we generally use is like a compounding pharmacy ointment. It's called a nifedipine compounded ointment, and then that also has this same effect with relaxing the muscles and helping heal the fissures.